Thank you, Mike. Well, as more people are getting vaccinated for COVID-19, some troubling statistics are beginning to emerge. Fewer people of color are getting the vaccine. And WJZ is live at Baltimore City Community College. Joy Burnett tells us how organizations are collaborating to encourage them to get the shot. Joy.
Denise, good evening. Well, this is becoming a concerted effort to boost the trust. If you dig a little bit into the data, you'll realize that white people here in Maryland are more likely to get that vaccine when compared to people in underrepresented groups like African Americans or folks in the Latinx community. Officials know this. They know that there is a history of mistrust, and they're trying to fix it. The lines are long for people who want a vaccine, but in some cases, very few people of color show up. Maryland recently started releasing a breakdown of who's getting vaccinated, and this graph shows it's overwhelmingly white. They make up 58% of Maryland's population. Health experts believe some people of color look to history as a reason to not trust vaccines.
What are some of the things that people are saying about why they're hesitant to take the vaccine?
Well, they go all the way back to Tuskegee. And then, where they had the men who had syphilis and they were not treated. Some of them go back to Henrietta Lacks, which is right here in Baltimore.
But Dr. Bronner also says things are changing because medical professionals are listening more. Baltimore City's health department will be holding 20 listening sessions to hear people's concerns. And they're also bringing resources right to the communities that need it. Just today, a mobile unit vaccinated residents at a senior home in South Baltimore's Cherry Hill neighborhood. Hospitals realize they have a role to play too. Staff at Grace Medical Center in West Baltimore have gotten the shot. Now they're taking their mobile unit on the road to educate and encourage people to get the shot too.
Yeah, I think many folks, when the vaccine first came out, they were hesitant because they wanted to see what would happen after the second dose. And as our leaders, Dr. Brown and others received their second dose, we suddenly had a rash as well as education that we provided.
Dr. Bronner at Morgan State University said at this moment when there's a focus in getting people in the underrepresented communities this vaccine, there also needs to be a focus in other issues like good health care and good jobs. Live at 6, Joy Burnett for WJZ.